Welcome to KCLEVATE's video series. KCLEVATE is King's College London Bangladesh Society's outreach programme for students looking to get into university, focusing on admission to medicine, dentistry and law. You can find out more by visiting our social media on the screen. This video, the first in the series, will be on the UCAT and we'll be covering what the UCAT is, what its format is, how to prepare, and what to avoid. If you'd prefer to skip to a certain section, just navigate to one of the timestamps shown on the screen.
What is a UCAT test, how much does it cost, and who is it for? The UCAT test is a 2-hour computer-based test which is comprised of 5 different sections. It's comprised of verbal reasoning, decision making, quantitative reasoning, abstract reasoning, and situational judgment. Each section is separately timed and has a varying number of multiple choice questions within them. The score for each section is given between 300 and 900, with 300 being the lowest and 900 being the highest. However, things are slightly different for the situational judgment section, as for this section, the score is given as a band between 1 and 4, with 1 being the highest and 4 being the lowest. Medical and dental applicants use the UCAT test for their university applications. However, not all universities may accept the UCAT test as they may have alternatives, so it's worthwhile to check the UCAT consortium to double check whether the universities you're applying to accept the UCAT tests. It costs £75 if you're taking the test within the United Kingdom or the European Union, or it costs £120 if you're taking it outside of the UK or the EU. Registration has already begun on the 1st of July and ends this year on the 17th of September. The testing period runs between the 3rd of August and the 1st of October this year as well.
A UCAT bursary is also available provided that you qualify for these criteria. You can find out more by Googling UCAT bursary. What is the format of the UCAT? The UCAT is split into 5 different sections: verbal reasoning, decision making, quantitative reasoning, abstract reasoning, and situational judgment. Section 1. Verbal reasoning. The first section, the verbal reasoning section, aims to assess your ability to read and think carefully about information presented to you in passages. This is important as doctors and dentists need to be able to quickly absorb information and relay this information to patients in ways that are easy for them to understand. This section has 44 questions with 1 minute instruction time and 21 minutes to answer, which leaves you roughly 28 seconds per question. Some questions assess your critical reasoning skills, and you'll need to be able to make inferences or draw conclusions from the given information. You may be given a question or an incomplete statement, followed by 4 responses, and you have to choose which one fits best. For other questions, you'll have to read a passage of text and then decide if the statement they've given follows logically. For this section, the answer can either be true, false, or can't tell.
Section 2. Decision making.
So now onto the decision-making part of the UCAT exam. Now the decision-making part is made up of 29 questions and you have 31 minutes to answer all of the questions. This includes your 1 minute of reading time. You've got 2 different types of question formats. The first being a yes or no statement, where they will give you a statement and ask you whether it's true or false, yes or no, and a multiple choice question where they ask you a question and they give you 4 different options to answer from and 1 will be the correct answer. So this part of the UCAT tests you on 3 separate skills. The first being your ability to apply reason and logic to a problem, the second being your ability to evaluate an argument, and the final being your ability to gain information from different datasets and statistics. This is important because as a doctor, you're going to make tough decisions and this basically tests your aptitude and if you're up to it.
Section 3. Quantitative reasoning.
So Section 3 will test your ability to use numeracy skills in problem solving. The questions will be fairly GCSE level, but the focus is on problem solving itself. This is relevant to your degree because as a doctor or a dentist, you're going to be encountering loads of data that you need to process for different calculations, such as drug calculations using weight, age, so on and so forth. In this section, you're going to have 36 questions to answer in 24 minutes. That gives you roughly 40 seconds to answer each question. There will either be individual questions which come with their own set of data, or there will be a group of questions which come with one set of data. Each question comes with 5 options and you have to choose whichever one you think is right. For example, There will also be an on-screen calculator which you can use and a whiteboard and pen provided to make any calculations that you want. So my tips for quantitative reasoning is that A, familiarize yourself with the topics that come up in the section. For example, percentages, currency conversion, speed time graphs, pie charts and how to read them, mode, median, mean, etc. The second is that you simulate test conditions, so practice under time conditions as much as possible, because the hardest part about the section is completing it in time. Another tip is that you identify common mistakes. So as you're practicing, just write down any mistakes that you make with certain topics and then just go over them again.
Section 4. Abstract Reasoning.
So for section 4, you're going to be assessed on whether you can identify patterns amongst abstract shapes and dismiss any irrelevant material that may cause you to get the wrong answer. This is relevant to your degree because as a doctor or a dentist, you're going to be presented with loads of information and you're going to have to decide what is the right information and the wrong information, or the irrelevant information, so that you can come to the right conclusion about how to treat a patient. In this section, there are 55 questions which you have to answer in 13 minutes after the 1 minute of instruction time, which only gives you 14 seconds to answer each question, roughly. So there are 4 types of questions which can come up in this section, and examples will be on the screen as I'm describing them. So type 1 and type 4 questions are very similar, and they're the most common questions which appear. Type 1 questions will present you with 2 sets of patterns, set A and set B. Then they'll give you a given test shape which you have to choose. Either belongs to set A or set B or neither. So the 3 options will be set A, set B or neither. Type 4 questions will present you with 2 sets of patterns, set A and set B, and then there'll be 4 options and you have to decide which one belongs to either set A or set B. Type 2 questions will present you with a series of shapes and you have to decide what comes next in the sequence of shapes, and they'll give you 4 options to choose from. And then type 3 questions will provide you with a statement and you have to decide which test shape completes that statement. My best piece of advice for this section is that whenever you're practicing questions, whether it's online or in a textbook, whatever patterns that come up, write them down. Make a list of any patterns that appear, so that by the end of your practice, you have a list of patterns that you'll be familiar with or rules that you'll be familiar with. So when you come to the real exam, you'll be able to recall a list of patterns, and that might make it easier for you to recognize the patterns in the real thing.
Section 5. Situational Judgment. The final section is the situational judgment section, in which they'll be assessing how well you understand real-life situations and your ability to identify the factors and the appropriate behaviours in dealing with them. You don't need any prior medical knowledge to answer these questions. It's relevant because they're going to be assessing a number of qualities that are needed in the healthcare profession, including integrity, perspective taking, resilience, etc. It's also used in the healthcare profession for even after you enter university. So for example, it's used in the selection of foundation doctors and dentists. It's the only section where your score is given as a band and not a numerical score. So there are 4 bands, with type 1 being the highest and type 4 being the lowest. There are 69 questions. You'll have 1 minute of instruction time followed by 26 minutes of testing time, and that roughly works out to about 22 seconds per question. There will be 22 scenarios with up to 6 questions attached to each scenario. You'll be given a range of responses for a situation, and you'll be asked to rank how appropriate or inappropriate those responses are. How to prepare and resources to use. There are a number of resources that you can use, but I'm just going to talk about the most commonly used and the ones that I think are the most helpful. So firstly, the one that I used the most was Medify. It's a paid service, so you pay £35 for 1 week, £45 for 2 weeks, £50 for 1 month, and £60 for 2 months. So one of the advantages is that you can choose how long you subscribe for. Another advantage is that it's computer-based, which means that you can simulate the online experience that you would have in the real UCAT exam, and you can get used to using the on-screen calculator and all of the keyboard functions in the real test as well. There are thousands of questions, and they also give you a breakdown for your answers, so that means that you can identify your strengths and weaknesses and thereby work on your weaknesses a lot more.
Another thing is that they also have 8 full-length mocks and 18 mini mocks, which means that you can practice a lot and simulate the testing experience. The next resource that I used was the 1250 UCAT practice questions book. So as you can see, there are a lot of questions to practice from, and they also have a full-length mock exam at the end of the book as well, so you can use that to help you prepare additionally. It's also cheaper than Medify, so I think it's £15 on Amazon, but one of the drawbacks is that because it's a book, it's not going to simulate the real-life experience of doing the UCAT on the computer. Additionally, the questions are generally a little bit harder than you would have in the real UCAT exam, but I wouldn't necessarily see this as a disadvantage, because if you're able to answer the more difficult questions, then that means that hopefully the UCAT exam should be a little bit easier for you. The next resource that I used was the UCAT's own website. So they have 400 practice questions, and they also have 3 full-length mock exams. Because it is the UCAT's own website, the questions are of course of the same difficulty and standard as you would have in the real exam. The only things that I would say about it is that the on-screen calculator pops up in a different window, but of course if that doesn't bother you, that's fine. Additionally, the practice questions will explain the answers, but you don't get an explanation for the mock exams, so that can be a drawback as well.
What to avoid when preparing. Our first tip of what to avoid is very expensive resources. Many companies might package information that's freely available on the internet and sell it to you for a premium price. We also recommend avoiding cramming information. It's much better to spend a couple of hours for a couple of weeks in the run-up to your exam than to spend the last few days before your exam cramming information throughout the day. You can aim for a high score above 650 or even 700 as long as you practice every single day for a couple of weeks in the run-up to your exam. Make sure that you work through the questions quickly whilst reading them carefully. Don't ponder over a question for too long, as it might be easier to just move on and then return at the end if you have time. It's better to get one question wrong than to spend a lot of time on a question and miss easier questions that you might have been able to answer correctly.
Key takeaway points.
Make sure you do as many practice questions as possible. Time yourself while practicing so you can get better at performing under pressure. Expensive resources aren't necessary, and you can find what you need online for free. It's okay to flag up a question and skip it and return at the end if you have time. It's better to get one question wrong than to spend a lot of time that you could have otherwise spent getting other questions right. Practice as much as possible, as practice really does make perfect.
Thank you for watching our video, and we hope you learn a lot about the UCAT. Please help us to reach more people by sharing with your friends, following or subscribing, and commenting what you'd like to see more of. This is part of our KCLEVATE video series, and the rest of the videos can be found on our YouTube or IGTV page. We wish you the best of luck with your university application.